Here at the Women's Center, one of our main passions is early detection and diagnosis of breast cancer. According to statistics, 1 in 7 women may be diagnosed with breast cancer in her lifetime, making it the most common cancer among women. There are over 200,000 newly diagnosed breast cancer cases per year in the United States and 4,500 here in the Bay Area. This is a disease that touches all of our lives in one way or another. And despite what many think, most women diagnosed with breast cancer have no specific risk factors other than the 2 main risks, being a woman and having breasts. And 20% of breast cancers diagnosed are in women in their 40s, some are even younger. The great news is the past 2 decades have seen significant life-saving new technologies in the area of early detection and diagnosis, and new surgical, radiation therapy, and oncology approaches to manage this disease. In the year 2010, women facing the sometimes terrifying news that they have breast cancer will find themselves seeing a team of very specialized physicians consisting of breast radiologists, surgeons, radiation therapists, oncologists, and plastic surgeons, offering them very individualized, tailored treatment options based on the specifics of their tumor, for example, size, stage, and receptor status. Many women will find themselves having breast conservation followed by radiation therapy. Other women will receive hormonal therapy or chemotherapy, and some women may have molecular oncologic testing to determine whether chemotherapy would be beneficial or not needed. The ultimate goal is cure with minimal side effects. Of course, the single most important impact we can have on this disease is early detection, and that means regular screening mammograms. Women in their 40s and 50s tend to have more aggressive tumors, as well as the potential of saving many years of life, which makes screening in this age category crucial. Yet despite all of the success of screening programs over the past 2 decades, the controversy and debate surrounding screening mammography came to a climax last fall when the government-sponsored United States Task Force withdrew its support for screening mammograms for women in their 40s completely and women older than the age of 74, and changed the interval screening guidelines for women in their 50s and 60s from every year to every other year. Despite all that we know about breast cancer, and with the startling absence of any new scientific data, these new guidelines were met with immediate opposition by all of the major medical groups. Certainly myself and all of my colleagues in other specialties urge all women to begin screening mammography at the age of 40 and every year thereafter. Women with a first-degree relative with premenopausal breast cancer should begin screening 10 years earlier than the age at which their mother and or sister was diagnosed. And because mammograms are not a perfect screening test, some high-risk women are also candidates for additional screening with ultrasound and MRI. Since mammography screening programs were initiated 20 to 30 years ago, the death rate from breast cancer has decreased for women in all age groups, and treatment options have significantly increased. Our own statistics from Mills-Peninsula have shown that 34% of screening-detected breast cancers were stage 0, ductal carcinoma in situ, the most curable form, and 80% were stage 0 or stage 1.